Well, good morning, Queenslanders, and what amazing news today, a double donut day. That is fantastic news to not only have zero community cases, but also zero cases as far as any overseas arrivals as well. So that means we remain at 31 active cases. We had 15,704 tests in the last 24 hours. So that's wonderful to see Queenslanders still coming out and getting tested if they've got any symptoms whatsoever. We had 18,776 vaccines yesterday, and excitedly we hit that 50% mark. So we are 50.3% of eligible Queenslanders are now fully vaccinated. That means 1 in 2 eligible Queenslanders now have had 2 doses of the vaccine. That is wonderful news, but of course we want to see those numbers go even higher. We're at 68.78% of first doses across Queensland. But we know that is not even across Queensland. We know there are communities like here in Rockhampton, and it's wonderful to be here with Barry O'Rourke, the local member. We know that there's areas that have lower vaccination rates, and our biggest concern is, of course, that these areas will become ground zero when the vaccine does move through our communities, and it will. But because of the wonderful work that Queenslanders have been doing, and particularly in those local government areas where we've had restrictions over the past week, so 5 LGAs in southeast Queensland plus Townsville and Palm Island, because of the great success we've had, we are announcing today that we are lifting those restrictions, that we will have the same level of restrictions across the whole of Queensland again, so our lowest level of restrictions other than mask wearing. And we're going back to stage 3 of mask wearing for our 11 LGAs. That means that when you're outdoors, you should carry your mask on you at all times and wear it where you can't socially distance. Indoors, you must wear your mask while you're moving around, but where you are seated, workplace, stadiums, theatres, schools, you can take that mask off once you're seated. Now in cafes, restaurants and pubs, we are now lifting restrictions even more. You only need to wear that mask while you're entering and exit. So that means while you're standing up and having a drink, you can have that mask off. Also means dancing is back and you don't need to wear that mask. So that's great news for everyone. It also means, importantly, that you can visit loved ones again in our hospitals, aged care, disability facilities and correctional services. So there is no reason from 4 p.m. today that you can't go visit a loved one in an aged care setting or a hospital. So we know how important this is. It's always hard when your loved ones are in an aged care facility and you haven't been able to visit them. So we're so thrilled that we can lift these restrictions from 4 p.m. today. We're back to 100% seated capacity at stadiums, theatres, cinemas, and of course back to 1 per 2 square metres at venues. So please check the website. We'll have the new roadmap going up today, but very much the restrictions that we've had before, some of the lowest restrictions in the country. So really exciting news. Well done, Queenslanders, but keep coming out and getting tested if you have any symptoms whatsoever. Good hygiene, social distancing, and of course, get vaccinated. That's why Dr. Young and I are in Rockhampton today. Central Queensland, we need your help. We've got to get these vaccination numbers up. We've heard time and time again over the last couple of days, people have been saying, oh, we will get vaccinated, we've just been waiting. Well, time is up. Do not wait any longer. This virus will spread throughout our communities. Once the borders are open, there will be community spread of this virus. It will come in every single community. The key is, will your town be ground zero? Will this virus spread through your schools, through your workplaces and into our hospitals because your vaccination rates are not high? Only you can decide that. We can plan for all of this, but you get to decide whether you're going to keep yourself safe, your loved ones safe, and make sure you're supporting your local community and your local economy by getting vaccinated. Don't wait, do it today. There is great capacity everywhere, including the wonderful centre we're doing today. We're here today. Great numbers over the weekend. This is double dose weekend. 3 weekends ago, we had the Supervax weekend, and this weekend is another Supervax weekend because all those people are coming back for their double dose. But we still have lots of capacity for first doses and walk-ins, so please come out and get vaccinated. I'll now hand over to Dr. Young. We'll hear from Barry and, of course, Steve, our Chief Executive here in Central Queensland Hospital and Health Service, and then we'll take some questions. Thank you.
Thank you, Minister. Yes, so this is excellent news. Due to the tremendous work done by Queenslanders, we've had another outbreak that I believe at this stage has been averted. So it was 1 week ago that we had our last case announced in the aviation cluster. Since then we've had some more, but of course they were all in quarantine during their infectious period. So that means from 4 o'clock today we can remove those restrictions and go back to the position we were at before. I have asked that people continue to wear masks when they're in one of those 11 southeast Queensland LGAs, just as an added precaution, but you don't need to when you're seated or when you can socially distance. So that's important going forward, just for another 2 weeks. So remember, we review the mask situation every 2 weeks on a Friday. So this is really important. The other thing I'm very, very grateful, and it makes me confident of where we are today, is the amount of testing that people are continuing to do. So over 15,000 people yesterday came forward and got tested. And I just remind people that is so critical. Any symptoms at all, don't second guess yourself and question whether it's your hay fever or asthma or something else. Just come and get tested. Then you'll know whether or not you've got COVID. And it's because people have been doing that for many, many, many months now that we've been able to get on top of our outbreaks so quickly, because we've been seeing the first case in that cluster. So therefore we haven't had to go back and find a whole lot of generations of transmission. So please continue to get tested. If you're in one of the 11 LGAs down in the southeast corner, continue to wear masks when you're unable to socially distance to protect yourself and your family. And then most importantly of all, get vaccinated, because we know it takes 5 to 6 weeks to get full protection if you have Pfizer or Moderna, from first dose to full protection, and no one can predict where we'll be in 5 or 6 weeks' time. So although you mightn't have had any COVID in your own community for a long, long time, as is the case here in Rockhampton, we don't know what's going to happen going forward. So just come and get vaccinated. Don't wait any longer. We've got plenty of vaccine. There's plenty of places you can get vaccinated. You can get vaccinated with GPs, in pharmacies, in our Queensland health clinics. There's lots of places. We've got lots and lots of vaccine. So I know that they've done a really good job here in Rockhampton, keeping the virus out of your community, out of Gladstone, out of Emerald, out of Rockhampton, but they mightn't be able to the next time because you haven't seen Delta here, and we know the Delta variant will just come into a community and find the people who aren't vaccinated. So come forward, 12 years of age or older, and get vaccinated. Thank you.
Good morning. I'd like to thank the Minister for Health, Yvette Darth, and Dr. Jeanette Young for coming to Rockhampton to talk about the importance of being vaccinated. We have so much capacity here in Central Queensland to get vaccinated. I can't encourage people enough to come get vaccinated. It is so important. We need to make sure that we have very high vaccination rates into the future. I'd also like to acknowledge the great work of our GPs, our pharmacists, and also Queensland Health staff that have been doing an absolutely wonderful job in administering the COVID vaccine, and I really truly thank them on behalf of the people of Rockhampton. So I just would like to encourage you, please come and get vaccinated. It is so important. Thank you.
Thank you, Barry, and thank you, Minister and Chief Health Officer, for coming to Rockhampton. It's absolutely fantastic to see you here. I certainly want to echo that message of come forward, get vaccinated now. Now is definitely the time to be vaccinated, and we've got capacity. You can walk into any of our clinics, and we'll vaccinate you the same day, and you'll leave with your second vaccination already booked in. So come forward, get vaccinated at our clinic, open this weekend at Rockhampton on Saturday and Sunday, at Gladstone on Saturday, but we're also delivering vaccinations elsewhere, so we'll be working with Emerald State School on Saturday and Sunday this weekend to allow anyone to walk into Emerald State School and get vaccinated this weekend. You don't need an appointment, just come on in and we'll provide that vaccination. And also at Tanham Stands State School on Saturday, again, you don't need an appointment, come in, walk in, and you can have that vaccination there and then. And in both cases, you can leave with your appointment already booked for your second dose. It's also great to see that we've now got 2 vaccination vans that will be deploying right across central Queensland. We'll start using those next week, going to locations such as Rookwood Weir Construction Camp. So there'll be many opportunities in businesses and communities for you to receive that vaccination right adjacent to where you live, to where you work. So please come forward, get vaccinated. Our teams have done an outstanding job across the hospital and health service, across GPs and across pharmacies. There's a great partnership effort. We can deliver across that whole system 20,000 vaccines a week with all of our GPs, with all of our pharmacy staff, with all of our clinics across the hospital and health service. So have no doubt you can get your vaccination if you come forward, if you walk in or you book. So please, please come forward now and take that vaccination. Thank you.
And can I just clarify that that's the high schools at Tanham Sands and Emerald, so make sure that you come out. If you're part of the school community, we want to see the students, the parents, the grandparents, siblings coming to their local high school and getting that vaccination. But of course, anyone from the community is welcome to go to those high schools this weekend and get vaccinated. So you can find out which schools on our Queensland COVID website and the times that they'll be operating. We want people to come out and get this vaccination. And these new vehicles that are hitting the road and doing outreach, I'm so excited that we're going to have these pop-up clinics happening all over the place. So if you just happen to be driving down the road and you see one of our COVID cars parked on the road with a marquee up, pull up and see if you can get a jab. I'm sure they'll be keen to give you a vaccination there and then. So don't wait. You know, sadly, one person on the 16th of June has resulted in over 60,000 cases in New South Wales alone and over 400 deaths. That is more than 100 people dying a month from COVID that started with just one case over 3 months ago. It shows what can happen. This is as real as it gets. Please come out and get vaccinated. While other states are trying to vaccinate their way out of lockdowns, let's get vaccinated so we don't need to lock down. It's your choice. We ask you make the right choice to keep yourself safe and to support your community, our health workers and your local economy. Questions?
Minister, who is in charge of the home quarantine selection process? Is it QPS or Queensland Health?
So we're working hand in hand. So those people who are eligible for travel declarations, which means they're not seeking exemptions, they're Queensland residents wanting to come back, then the Queensland Police Service is working with them, and also Queensland Health's working on the exemption units. We're working hand in hand, and we're going through all of these groups to identify people who may be eligible under our criteria. We have over 300 people who have already been identified as eligible, so well done. It means you're fully vaccinated and you are ready to come into Queensland from Monday. So we will see those numbers go up as we continue to reach out to people who are interstate, who are trying to return to Queensland.
For those people that are stuck across the border that aren't eligible for home quarantine, what will happen with those?
So we still have people coming into hotel quarantine every day. So we're taking people who are returning residents, Queensland residents, and we're also taking people who have been granted exemptions. So we'll continue to have places available for hotel quarantine, but in addition to that, we're opening up another 1,000 opportunities for people to home quarantine if they can meet that criteria.
Minister, how many hotel rooms are available for the home quarantine system? Is it true there are only 245?
Look, it varies how many are available. We also need to have rooms set aside for international arrivals because although we have a cap, the Commonwealth decides whether people can come over that cap, and we have to make sure we've got rooms for them on any given day. And that's been actually double what our cap is. So we have a lot of international arrivals still coming in, and we work with the hotels. But we do have a limit of rooms. That's why we have said that we need to work through a process to make sure we can get people back safely.
When will we set a date for reopening the border?
So as the Premier said, this is a decision that's being discussed at National Cabinet. There is further modelling being done. But if people want to see the borders open, there is one thing you can do that is in your control and your control only, and that is getting vaccinated. The more people that get vaccinated, the safer our community is to be able to open up the borders.
Will fully vaccinated tourists have to quarantine at the Wellcamp or Pinkenba facilities? If so, why?
Look, we're still working through that at the moment. If you arrive into Queensland from an international flight, you still need to hotel quarantine. This is really important. We have had a very, very high rate of overseas arrivals who have been positive with virus, not just the virus, but with the Delta variant. So it is really important that we support those people to quarantine and keep our community safe. Many of these people don't have a residence in Queensland. They're arriving here having been out of Australia for many, many years, and so they don't have a home that they can quarantine in. It is really important that we have these facilities available.
Minister, do you think by the end of this month, every eligible Queenslander would have been given a fair opportunity to get the vaccine?
I don't believe that Australia has the full amount of vaccine available to offer it to every single person by the end of October, but we do expect that November, based on the numbers that the Commonwealth are telling us should be coming in, the volume of vaccines coming in, that we are getting close to be able to offer it to everyone. I can say this though, there is more than enough supply here in central Queensland.
Do you think by that
No
time,
hesitation, you can come and get a vaccine, there's plenty of supply here.
once everybody's had the opportunity, do you think then the borders should open?
Well, look, Dr Young and the Premier has made it very clear that they believe as an absolute minimum that to open the borders, we need to make sure that every single person who is eligible can get the vaccine, that there is enough supply for them, because it would be extremely unfair to simply open up when people who want it haven't been able to get it. But we have a lot of supply now, and there is absolutely no reason for people to be delaying getting vaccinated.
The data shows primary care has been doing the heavy lifting for our vaccine rollout. On the Gold Coast, GPs are reporting a decline in vaccine uptake. They say people are complacent. Do you believe Queensland can actually hit that 80%?
Well, can I say thank you to our GPs and our community pharmacies. This was always the plan with the federal government, that the state governments would administer 30% of the supply to our priority groups, and 70%, being the general population, would get their vaccinations through GPs and community pharmacies. Now, of course, we've got plenty of the general population coming into our hubs as well, but I do want to thank them because we can't do it alone. I absolutely believe that we can get the 80% mark. In fact, I believe we can get well above that, and we are actually starting to see that already in some parts of Queensland that are doing far better in vaccinations than others. So yes, we can hit 80%, we can do better than that. Over 95% of our kids are immunised in Queensland. 95% are immunised. So if we're willing to jab our kids, then every adult should be able to step up and get vaccinated as well. So we will get to that 80% mark and beyond. But we've been really fortunate in this state. We haven't had major outbreaks like we've seen interstate, but the virus is going to come. This is inevitable. We've seen it all over the world. When we open up, the virus will move through our communities. Please don't be ground zero in central Queensland and have your community extremely unwell and in our hospitals and in ICU on ventilators, and worst case dying from this virus.
Queensland health reps attended AMAQ meeting last night about ambulance ramping. Do you know the outcome of that meeting?
No, I'm not aware of the outcome of that meeting, but certainly we'll be looking forward to an update today on that. But we welcome the feedback from the AMA. We know our hospitals have been under pressure. This is not something new. We've had growth happening across the state year on year. We have had significant increases in presentations in our emergency department and in bed capacity. This is why every single health minister in Australia has written to the Commonwealth and said, please support us urgently, because our demand is already high. When you put COVID over the top of that, we are concerned about what that's going to do to our health workforce and to our hospitals. Now, the public can help us there by getting vaccinated, but we need the Commonwealth's support as well.
BHP will impose a vaccine mandate on its workforce from January 2022 onwards. Do you support that decision?
Look, that's a decision for businesses, but can I say BHP, as with all of the resource sector, has worked tirelessly with Dr Young from day one and with the government, and we thank them for that. They've done such a great job. We have not seen a major outbreak in our resource sector, and we know how devastating that would have been if that had occurred. So, you know, this is a decision for them. We've mandated it for our health workforce, for our police and for aged care facilities, because they're dealing with the most vulnerable people in Queensland, and we think that's right. But as far as other sectors mandating, these should be discussions at the national level. Of course, it is a decision for individual industries and businesses.
The CFMEU have come out against it, arguing that it tilts power too favourably in favour of employers over Labor. So just to clarify, you rejected that position, and you're willing to support businesses having that sort of power over their labour?
Well, look, this is a decision for businesses, but you know, I've heard some comments this morning from the CFMEU. There should be consultation. We certainly sat down and consulted with the unions across the entire health workforce. We want to work with the unions on this, and I'm sure BHP understand the importance of doing that as well. But this is a decision for BHP. What I do say is that they've worked well with the government and with the Dr Young throughout this pandemic to try to ensure that the resource sector continues to be open and supporting jobs and supporting our economy.
Minister, will police, just touching back on home quarantine, will police be checking on people in home quarantine, and if so, what strain will this put on our force?
Look, we have set up a great compliance and enforcement scheme since day one. So we set up a monitoring, compliance and enforcement team back in March, April last year to ensure that the tens of thousands of people who have been in home quarantine comply with that. Now, we've just taken a step up from that in the last 3-4 weeks to implement a new home quarantine check-in system. So not only, or instead of doing the phone calls and checking on people every few days, every single day someone in home quarantine is getting a text message with a link that they're required to respond to within a certain period of time that will tell us whether those people are at the residence in which they're required to quarantine. It also allows us to check on their welfare. So it's a great system. We've seen an extremely high level of compliance, but where someone is found to not be responding to their text and then not answering phone calls, those people should expect a knock on the door from one of our enforcement officers. They could be fined, and they also could be forced into hotel quarantine at their own cost.
Minister, would you say the vaccination rate at Queensland Health state-run clinics are starting to plateau?
No, I'm seeing a bit of a take-up in the last week, which is fantastic. Even when we were in Mackay yesterday, we saw they were having a really great uptake in the last few days. We know this weekend's going to be a bumper weekend because everyone's coming back for their second doses. And I think now's the time. People are starting to realise, as we talk about Christmas, as we talk about borders opening, I think people who have been sitting back waiting realise, I can't wait any longer. You know, this is going to come, and if I'm not vaccinated, I could end up with this virus. I could end up infecting other people, including vulnerable grandparents and other relatives and friends, and I could end up being one of those people on a ventilator in our hospital.
Thanks, guys.
Thanks, everyone.